An Onchan MHK has described Manx Care as broken and at risk of collapse entirely without doctors. Julie Edge says the health body is not working for the island, and industrial action planned for next week highlights the critical need to value and support the medical professionals. The British Medical Association has taken the decision to strike next week from 7 o'clock on the 22nd of January to 7 o'clock on the 24th. Well, Miss Edge joins us on the line this morning. First of all, what do you make of that decision by the BMA? Do you support it?
I think it's been going on for significant time. Well, it has been going on for significant time. We need to remember this is the pay for 23-24. If you look at the news item, it's with regards to that. So it's already out of date. And I've never actually, in all my life on the island, known us to take so long with our doctors and that. Certainly since Manx Care have taken over, I appreciate, and the whole island appreciates, so we do need to make changes. But sometimes you need to make the changes in the right places. We need doctors. We live on an island and we cannot afford to be in dispute with our doctors and strike action.
You have been one of the only, if not the only, MHK so far to go public with your thoughts about the strike action. Has that surprised you, particularly when the health service and its performance has been such a topical issue, both on the doorstep at election time and of late?
It has, to be honest, Lewis, but, our colleagues are concerned about health. Clearly, we all are very concerned about health, but I do feel there's an element at the present time that people perhaps are getting a little bit afraid to speak up, a bit like the public. I get many, many whistleblowers still. But the most important thing for our island is to have a good health service and to ensure that our doctors are paid appropriately and accordingly. And this should have been sorted before it got to this. And I know people will say, well, you've been involved in strike action at the post office, strike action with teachers. I don't believe the same amount of negotiation and communication and collaboration with our doctors has taken place.
Well, Manx Care does say negotiations are continuing. But Miss Edge, have your constituents raised concerns about how this industrial action could directly impact on them?
They have. And actually, I was speaking to GP services yesterday, so to some people that I'm aware of in there. And I think what the Manx public do need to be made aware of, this is just Manx Care GPs. And obviously, a lot of our GP services are independently run. So I think that would have been a great message to be put out quite quickly to the public with regards to that, because the first point of call for any issue with your health is your general practitioner and your GP services.
We've invited Manx Care for interview. As we've mentioned, we also invited the Chief Minister, Alfred Cannon, to join us. He deferred to the Health and Social Care Minister, that's Claire Christian, but she declined the interview opportunity whilst negotiations continue. What do you make of that? Do you think the Manx public need to hear from those at the top much more quickly on this?
Certainly, and I can understand whilst negotiations are ongoing that could be the case. And actually, this is why, in a way, that the ministers should not be directly involved in those negotiations. This is why you should have independent, and particularly when I do believe that we should have got independent negotiation, like I did for education. The new minister probably hasn't had that opportunity or chance because it's been going on for such a significant length of time. She probably hasn't had that opportunity. But I can't obviously speak for them as to why they're not. But if you're in dispute, it is difficult. But there's things you can say to reassure our public. And I think that's the lack I'm seeing in this current government and from the Chief Minister. He should be reassuring our public all the time on issues when they arise.
You say that Manx Care is broken without doctors and it's time it was restructured as it's not working for the island. What do you think a restructure should look like?
Well, right at the outset of the Sir Jonathan Michael report, and that's our old hat now in my mind, really, it's not worked for the island, but I said it should have been a full statutory board model where the Manx Care had control of everything, and then you can hold managers and the chief officers to account. At the present time, they've got a lot of shared services and things that can disrupt and cause costs to them as well. However, I think the one thing that we really do need to do with Manx Care is complete forensic review of where the Manx taxpayers' money is going. It's virtually doubled since the Sir Jonathan Michael, and I know that was a recommendation, but it seems to have affected our services, and that's key for me. It's the services that have been impacted for the public of the Isle of Man. They seem to be they are getting worse. I've had written answers recently about the numbers through A&E, and I've had to challenge virtually every question I've had. And then it comes back with a different answer because I've had background knowledge and, to not even be getting the correct answers out from Manx Care. I think it proves, are they actually aware of what the Manx public had as a service prior to Manx Care? And I don't think they are. Yes, we had COVID. We're way beyond COVID. But the Manx public want a proper health service that can help them in their time of need.
And do you think that's what they're not getting at the moment?
I honestly believe they're not listening to the public. The public have been here a lot longer than a lot of the board from Manx Care. And I think it's time they listened to the people of the Isle of Man. We are an island. We're an island culture. We need doctors in an emergency, and that is what the Manx public is crying out for.
So you're critical of the Manx Care board there. So do there need to be changes at the top of Manx Care? Because over the last year in particular, Manx Care has been in existence for nearly 4 years. Over the last year, there's been one thing after another, the finances, services being cut, and now this industrial action. Do you think there needs to be changes at the top?
I think there definitely needs to be changes, but you need to change the structure of how the board can operate and the political oversight of the board.
So what can you, as a backbench politician, do about this? From this moment on, what can you do?
Well, clearly we had a debate about it. It was October, I'm trying to remember now, when the Chief Minister became the Health Minister, it was October, November. We had a debate. There was many good suggestions put forward there. We need to be putting far more money into our GP services and our community services. What can we do as backbenchers? Obviously, we're back into Tynwald next week. I've got a question, not an emergency question, about the strike action. I hope my colleagues will come on board and see the importance of an island and having a health service that works for the people. But most importantly, at the top of that profession is our doctors and our consultants. Stop saying they're getting paid enough already. When I worked in Old Nobles Hospital, consultants them days were on well over £100,000, and I'm going back 30 odd years. So consultants have always had good pay. Manx Care's paying them that pay. Some have come since Manx Care that are on significant salaries. And what they seem to have done is try to attract people, but paying them outside of the structure, but within the structure, and it's caused confusion. So it makes they're trying to make the Manx public think, well, the doctors, consultants getting £500,000. You need to understand what is that made up of? Is it the basic salary? I suspect not. I suspect there's a lot of additional time and work in there because we've not had consultants. If a locum can't turn up, our consultants then have to cover for the people's protection and safety on our island.
You mentioned before, Ms Edge, that you've heard from constituents regarding this industrial action and the concerns that they have. Have you heard from any doctors, any consultants that are undertaking this strike action?
I haven't heard directly from any that are, I don't know who is striking. I know obviously the survey was just done for the Manx Care doctors, so I expect it will be all of the Manx Care doctors. But I really do think, even looking at this, that there's a reason, these are the top professionals in our health service, and that full financial forensic review of Manx Care is long overdue.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.